Now we are going to discuss feedback and feed forward session. Purpose to deliver structured feedback and feed forward to the learner after they have completed the stimulation, which is based on communication, tone, reflection, and cultural safety. I am Jaswinder Palkar. I want to thank you for doing your role play. I am able to see that you did attempt to be respectful and calm when communicating with the patient. We can spend about 5 minutes and discuss what was good and when you may do that for the next time. I will use a very basic format. I will discuss your strengths first and what can be improved and what to do next. It is a safe learning environment. Remember, feedback is not judgment, it is growth. Strengths phase. You have started your discussion in a cordial and warm manner. Your pronunciation of the desired name of the patient was accurate and demonstrates cultural sensitivity and respect. You also provided him with an opportunity to invite a family member, and it is highly significant in the context of the Aboriginal patients who attach importance to family when making a decision about their care. You were in a fine posture. We had a good expression. You would smile and turn towards the patient indicated that you were attentive. I observed that you spoke simple English, and this is one of the largest aspects that make patient comprehend what is going on. The way you checked out at the end is another strength. You said you want me to repeat what you want me to explain. It is very supportive question, since it puts the patient back in control rather than presuming that he or she had understood. These behaviors indicate that you are building good cultural communication skills in general. Improvement phase. So you have some minor things to improve. The first is pacing. During the admission, you were talking too little too fast. The culturally safe communication style should see one slow down and allow silence to play out a few seconds. Silence is patient and it allows the individual time to think. The other domain is understanding checking is a more profounder manner. You can ask them to tell you in their own words what will happen next, instead of just asking whether they understand what will happen next or not. In that manner, you will be able to ensure that they are actually understanding and feel part of the team. So, I also found out that you did not mention culture or spiritual needs at the very end. Attempt to introduce that earlier on. This is an indicator that the outset of being open and non-judgmental. An example is introducing oneself and then saying, is there anything culturally important I should know to help you better? This is a terrific move. So, feed forward phase. The next time you need to strive to maintain your calm opening and have your patient set the tempo. Also, it is a good idea to pause after every question you ask. It will automatically slow the pace and demonstrate that you are listening. You can also use positive reflection words in the end, such as, I really appreciate you telling me that, as appreciation creates rapport. I would also like you to write a brief reflection journal following your next patient discussion. And admission. List one behavior of communication that was successful and one that you wish to improve. Such self reflection will assist you in a continuing and get better as in the line with the Nursing and Midwifery Board of Australia standards of professional development. The following week, we will engage in a similar situation, except that we will focus on discharge communication to enable you practice how to close the conversation without sacrificing the same cultural safety focus. So now it's closing. So on the whole, you did quite well today. You were caring, respectful, and ready to learn that is the core of cultural safety. These are not always easy talks, although every time you do it, you gain confidence and understanding. Continue to stress on respect, listening, and partnership. That is what makes a safe environment to all the patients under your care. Well done. Thank you, sir. You have done a good job today. Thank you.